Hello, everyone. Thank you for joining us. My name is Camille Brady. I'm with the Village Free Press and Growing Community Media. In case you did not know, May is Mental Health Awareness Month, and we have partnered with the American Foundation for Suicide Prevention, the Illinois chapter, to bring this presentation of Talk Saves Lives. We have two panelists with us. Mike Bushman is an AFSP Illinois chapter education co-chair. He is also the author of several books on youth mental health. We also have Vicki Webster with us. She is an AFSP Illinois chapter board member, as well as the executive director for the Reginald and Paul Sewell Foundation. Thank you again for joining us, and I'll go ahead and hand it over to Mike.
Thank you so much, Camille, and thank you to the Village Free Press and everybody, you and everybody you work with, for making mental health discussion in your community a priority and hosting this presentation. So we've got about 35, 40 minutes worth of slides, material to walk through on mental health, on warning signs of suicide prevention. And then we'll look forward to questions as we get to the end of this as well. So Vicki and I serve on the AFSP Illinois board together and are pleased to be partnering to present this to you. So one of the keys that we want to make sure everybody understands is that suicide is a health issue. And as we go through the presentation, I think it'll become clear why that's the case. We also think that suicide can be prevented. Now, there are a large number of suicide loss survivors, Vicki among them, and I want to be really clear here. We're not saying that the ones in the past should have been prevented. We're saying that in a world where we all understand risk factors, we understand protective factors, we understand warning signs, where we all have access to mental health services, that we can save lives. And we know when we do all of those that it makes a difference. So as we walk through the presentation, we'll talk briefly on the scope of the problem, a little bit about some of the research that's being done in the area. AFSP, the American Foundation for Suicide Prevention, is the largest private funder of suicide prevention research in the country, and we believe possibly the world, although we haven't surveyed the entire world to be sure of that. But it's certainly a big piece of what we do. Prevention is really critical. As I mentioned, there's a lot we can do. And then Vicki will also talk about what you can do. Things specifically, how do you have conversations to help people? Just a quick note on language, how we talk about suicide matters. So you'll hear in the media often, for those who we haven't gotten to yet, they'll use terms like committed suicide or successful attempt. We don't use those. And the reason we say died by suicide or ended their lives or killed themselves is committed suicide. The word committed is often tied into a crime, a sin, and it implies a level of control, a level of clarity of thought that research has shown just isn't there when there is a loss. So the scope of the problem, obviously, it's substantial. Now, the good news is the last 2 years for which we have data in the US, the numbers of suicide losses have gone down. So we've made some progress, but that doesn't mean that there's not substantial risk. Globally, 800,000 people die by suicide each year. That means somebody every 40 seconds is losing their life to suicide. In the US, suicide is the 10th leading cause of death. In 2019, which is the last year that we have that complete data, 47,500 people died by suicide. Now, for younger age groups, the 10 to 14-year-old, 15 to 24-year-old, and 25 to 30-year-old, suicide is the third leading cause of death. Until the last year, it was the second leading cause of death. Unfortunately, homicides among young adults have surpassed suicides in numbers in many states and communities. So, but still, it's a major source of preventable death. For every suicide, we know that about 25 others attempt suicide. At younger ages, there are more attempts per death, and as they get older, the number of attempts per death tends to get narrower. But so for if we're losing 47,500 people to suicide and there's 25 other attempts, our best estimates are well over 1 million people making a suicide attempt in the course of a year just within the United States. When those losses happen, they have an impact. They have a deep impact on the families. They impact friends. They impact people in their social network, whether it's in a faith institution or in a workplace or on a sports team or some other group in which these individuals had gathered. That impact is substantial and often doesn't get enough support, and we'll talk a little bit about that. Now, just real quickly on some of the research, there are some things that we have learned. AFSP has been funding research for a couple of decades, and among the pieces of information that we've learned is, in general, there's not a single cause for a suicide loss. It's usually a result of multiple intersecting factors. So there are a combination of factors that Vicki will talk about that have an effect, and it's the cumulative effect of those that becomes at some point more than an individual is able to handle. The large majority of people who die by suicide have a mental health condition contributing to their death. So mental health is really critical. Now, only about half of those who have a diagnosable mental health condition have been diagnosed. Many people are reluctant to go seek out therapy or support or getting a diagnosis. And of the people who have a diagnosis, a substantial number of them don't get treatment. So mental health conditions and have a key factor in suicide loss. And we want to make sure that, especially with this being Mental Health Awareness Month, that we emphasize how important it is to seek support, whether somebody's struggling with brain chemistry or their thought processes or impulse control skills. There's a whole variety of elements to how our brains work that we just might not have the skills to understand how to work with, and professionals can help us get there quickly. 1 in 4 people will experience a mental health condition. The vast majority do not go on to die by suicide. In fact, some research has shown that as many as 35% of people at some point in their lifetime will consider suicide, will think about the idea of suicide. The vast majority, it's a thought, and then they develop skills and access support and get the help they need to get to a good place. So we don't want to suggest that having a mental health condition means that somebody is going to die by suicide. In fact, that's the exact opposite. The vast majority do not. And even among suicide attempt survivors, the vast majority of them go on to live long, productive lives. So they get, after an attempt, access to the support and services if they can survive that attempt. There are physical differences, though, and this is something research has made clear in the brains of people who die by suicide. Brain chemistry can be different. Brain structure can be different. What parts of the brain are active? Our brains are really complex. Each one of us has a brain with 86 billion neurons in it. Each one of those has 10,000 points of connection. There's 80 different neurochemicals that move information around. So there are a whole lot of things that can affect that. And we do know that people who die by suicide have differences that we can identify. Most people who are suicidal are ambivalent about taking their life. One of the reasons that I got involved with AFSP and with writing about youth mental health is that I've struggled with depression at various points in my life. But for me, the worst of it was during a couple of years in high school. and suicide ideation was just a regular part of my experience. I was fortunate and really fortunate in just making it through that time period. A couple of lucky comments and questions from people at the right time, learning some self-care techniques, learning some impulse control skills have made an enormous difference. And I've had a long, happy, productive life. I've been married for 33 years, 34 years, sorry, I just had my anniversary. You have two adult children, had a great careers working in Congress and in the corporate world. And now I get to do this, which is something that it's a passion for me. But I do know that when I was struggling, I was in so much pain that I just wanted the pain to go away. It wasn't about wanting to die. It was about needing that pain to be gone. And that's not an unusual perspective for somebody who is suicidal, that desperation to escape the pain, the crisis point being reached. Sometimes we hear of an event, a job loss, a breakup, a divorce, a trauma, something like the horrific traumas that we've seen in the shootings in Buffalo and today in Uvalde, Texas, and that we hear about that and how it affects people around them, and don't realize that all of these other elements around mental health and loss of protective factors and other risk factors might be missed. And our thinking becomes limited. When we're under stress for too long, whether it's chronic or acute stress, there's actually a chemical that will build up around the fight, flight, or freeze part of our brain and makes it so that information just doesn't get to us as clearly. So the question is, who is at risk? And I'm going to turn it over to Vicki and let Vicki, if you could, just tell them a little bit more about yourself and the foundation that you started with your brother for your brothers.
Okay. Good evening. My name is Vicki Webster. I am a board member for AFSP Illinois chapter. I'm also the executive director for the Reginald and Paul Sewell Foundation, which is a foundation that my family and I started after the death of my first brother, Reginald, in 2016. We later lost his brother, my second brother, Paul, in 2018. So our family sustained 2 suicides back to back within 2 years. And we just at that time wanted to be an advocate for mental health awareness, to get people to know that it's okay to seek help, to get out, to seek, a provider if you're having some behavioral health issues, and that it's perfectly okay to seek treatment. So we've been advocating for mental health. We've been advocating along with AFSP, who's been very instrumental in helping me and my family with grief process. So they're an awesome resource, and I wouldn't be here today to be able to talk and tell my brother's stories without them. So we lost 2 brothers, and I can touch a little bit on each one as we go through some of the risk factors. 3 of the key elements to risk factors are health, historical, and environmental. Historical, 2 brothers, biological brothers, passed away with them 2 years apart. I want to say that Paul, which was the second brother who passed in 2018, had probably displayed more behavioral health challenges in high school, was in counseling, though he excelled at pretty much everything that he did, sports, academic, joined the service, still was doing great, but there were those challenges. Reggie, there weren't very many challenges that we saw, some underlying things, so we're still unclear what drove him to his decision. So as far as for other mental health conditions, I could speak on Paul's PTSD may have been from residual from losing Reggie, losing his brother. I definitely, I can speak on that and say that probably attributed to Paul's decision to take his life. So there, substance abuse, I know they both smoke marijuana, and I like to be candid about that. Because we would struggle with people not wanting to take prescription medications, but they rather self-medicate themselves with marijuana. And that's something that I've been trying to reach our younger population, our youth, to let them know that we take aspirins if we have a headache. So if there's some behavioral health issues that require medication, please, by all means, seek professional help. And if medications will be able to help you to cope, then by all means, follow a medication regimen. Um, Other health factors: chronic health condition, chronic pain, serious head injuries. Those are for also our parents who have athletes who play football, wrestle, baseball, basketball. You want to make sure that those children are protected with their head injuries. Concussions sometimes lead to those serious head injuries that can alter their thought process. Historical factories, again, they were biological brothers. They were actually adopted. My parents adopted. Paul was 1, Reggie was 4. So I can't speak on their past other than what my parents were told, but I do know there was some form of childhood abuse prior to coming to our family. And then again, with Paul, I do believe the loss of losing his biological brother 2 years prior had a big factor in his decision as well. Environmental factors: access to lethal means, exposures, prolonged stress, stressful life event. Prolonged stress, I know with Reggie, he had just been in between jobs. And at that age, he was 22. That's at the height of your age where you're trying to figure out things. And, you see on social media, where people are, and maybe they're at a higher level, money-wise, monetary or other things. And I think those things played a big factor with him. He put a lot of stress on himself. Instead of just being an average young man in college and working your way through your career once you decided, he just had an urgency to excel all the time, to always be on top. And I think stressful life events was just everyday events. Unfortunately, we live in a world where social media does play a big factor in determining how our young adult, perceives the real world. There's a warped perception. So I think there's always that stress on them to do better and not feel as if what they're doing is good enough, in the moment. So that's one environmental factor I can speak on, I think, with both of my brothers. And then what other areas, they're here on the slide. I'll just read them briefly. Genetic risk, depression, prolonged stress at work, drinking more than usual. These are things that we see, but they may not be aware of. And it's good to bring it to their attention. I see you're a little down, you're sleeping more, or you're not eating, you don't want to come out, or, we're having family gatherings, you're distancing yourself. So those were things that I saw with Paul, and, my siblings and I were very close. So we would kind of rally around one another, and then he would talk more about it. But as far as for opening up, completely, I think he wanted us to see what we wanted to see. He would often tell us that he would project what we thought he wanted to be. So he kind of hid a lot of things. So these are things to look for, and definitely have conversations and just do wellness checks on your individuals, your family and loved ones, to let them know that you do see a change, whether they don't or not, and it'll bring it to their forefront. And then hopefully you can convince them to seek treatment.
Yeah, Vicki, I just want to add a point here that sometimes when we all have bad things happen in our lives. We have days when we're really struggling, when something happens. If somebody's just had something, lost a job, relationship difficulty, and they're just not feeling good that day, you want to ask them about it. If after 2 weeks you don't start to see them pulling out of it, then it's time to be really concerned.
Right.
And to think, okay, this may be something that they might need some outside help beyond just talking to me and getting past it.
You're absolutely right.
Okay, so the importance of research, and this is just really to make the point that there are a whole lot of areas that we're doing research on. One of the difficulties with the whole range of mental health conditions that Vicki mentioned and talked about as risk factors is that it's hard to tell. You know, it's hard to get a proper diagnosis. There's no blood test. You know, it's not like when I get my blood test for cholesterol that it goes off to lab and it comes back and tells me my HDL and LDL levels. It just doesn't do that. But we're doing research to try and find those. And there actually are some gene research that has shown we know certain medications won't work with certain gene structures. So we've come a long way. Psychotherapies is really just the talk therapy. So to me, those are the people who provide brain coaching. It's when you're struggling, how do you think about things in a different way? And there are a whole range of psychotherapies that we know work, particularly for suicide prevention, as well as for general mental health improvement. And many of them have been tested in kind of the standard gold standard double blind research method, where we know, okay, if they get this kind of support, they're going to get to a better place. Interventions, safety plans. We know that people who have and maintain a safety plan, which is tells you what are your reasons to live for, who are the people that you need to call when you're struggling, because you know those are good people to talk to. What distractions get you engaged? It goes through several of those items. Those interventions work, but we don't necessarily know how to do them, so without learning them. And then, of course, medication can make a difference. And I have the good fortune of, for AFSP, getting to talk to a lot of young adults, and I'll ask them, how many of you know how to change your brain chemistry? And I've never had a hand go up. There are things we can do. Exercise, setting and achieving reasonable goals, making progress towards our goals. Our brain will feed us some great brain chemistry. Sometimes we need to have enough vitamin D in our system to get our serotonin flowing at a right level. That means being exposed to sunlight. So there are a whole range of interventions. And thank you for the comment about having never heard of safety plans. They're called safety planning interventions. If you look it up as the Stanley Brown safety plans, I actually had the honor of playing the patient with Dr. Greg Brown, who was one of the co-founders for the video series he did to train doctors, and it's now being used in social work and other training programs to help train on how to use safety plans. So I'm just a huge advocate personally for them, but we know from research that they work. There's a lot of other things that work for prevention as well. Certainly that whole range of mental health care. Family and community support is a big deal. And Vicki and I were talking before we started today with Camille about the importance of faith communities. We know that spiritual connection makes a difference. We also know that having a place that you go every week or regularly and people know you and they check in on you and they ask about you is a big deal. So having that family and community support. Problem solving skills. So knowing how to get through those really difficult times and figuring out how to solve problems. The more experience we have solving problems, the more likely we are when we get in a crisis to be able to think about alternatives to escape the pain rather than suicide loss. And then, of course, cultural and religious beliefs we know can be a protective factor. People who believe that they are here for a purpose can endure some incredibly awful things because they believe that there's a value that comes out of it. I happen to believe that the pains we experience in life, if we can turn those into something that helps other people, and which is part of why I do this, it then has value. Otherwise, it's just pain. So whatever difficulties and challenges you might have endured, if you can find some way when you get to where you're comfortable to use that to help somebody else, then then it has, some redemption value for us. No question, mental health care is an important ingredient. And there is also no question we do not have enough mental health care in Illinois. 3/4 of our communities are underserved with mental health support. And I know certainly for young adults, the waiting list for a child psychiatrist to see many mental, therapists, social workers, others who have a youth focus can be really a fair amount of time. So it is important to have people around them supporting them. And if somebody needs mental health care, just to have a friend who helps make the calls, because it really is frustrating to call and be told, yeah, I'm not accepting patients, or I've got a long waiting list. So one thing we can all do if we know somebody's struggling is offer to help them figure out where they're going to go to get the help that they need. The key is we just need a culture where everybody knows it's to be smart about mental health. I use the term when it comes to getting help that we should all be comfortable getting a brain coach. Just like we would get a teacher to teach us to play the 88 keys on a piano, to be able to figure out how to make our brains work effectively for us, to get somebody to coach us in that, I think is something that we should all be comfortable doing and seek out being able to do. So in terms of who can help, certainly a doctor, primary care physicians is actually where a lot of people go as their only source of mental health support. They tend to have knowledge in the medication area, not as much knowledge about cognitive behavioral therapy, dialectical behavioral therapy, attachment-based family therapy, the whole range of therapeutic options, and there are tons of them. So sometimes having somebody who understands the chemistry and somebody who understands thought processes can be valuable. For sure, get an evaluation, certainly discuss treatment options, and recognize that because you're an individual and your brain is unique to you, that medical professionals can help you, but only you know if it's working. So they may think that this is the right medication. If it's not working, you have to speak up for yourself. You may try a therapist and it may take you 2, 3, 4 times before you find the one that you actually connect with. And that's okay to change if you don't find the right person the first time. And most therapists, if you tell them, I just don't feel this is working, can you help me find somebody that you think might fit with me? We'll be happy to provide that connection for you. It is important to know that federal law does require insurance plans to cover mental health services the same as physical health services. State law in Illinois does as well. Now, does that mean it actually happens all the time? No, not yet, but it's getting better, and AFSP and other organizations have been working to make sure that that coverage is treated. And there are some court cases that are supporting expanding mental health service support as well. Now, for self-care, I mentioned a few of these. We know a certain number of things are absolutely essential. Sleep is fundamental to good mental health. Every time you have a thought, it creates waste material in your brain. That waste material is going to sit there until you have that restorative part of the sleep that comes at the end of the night. So if you're not sleeping well enough, it's really hard to think clearly and to get full access to the capabilities of your brain. Exercise, second most important thing beyond sleep. Just getting that movement, getting the blood flowing. And this doesn't mean going to a gym and running full speed on a treadmill. It actually just means, for many people, getting 15 to 20 minutes of walking a day can make an enormous difference, especially if you tend to be sedentary. 20 minutes of walking. And when I speak to young adults, I'll say it can be mowing the lawn, doing housework, anything that gets you moving. If you love to dance, that's exercise. So find something that you like to do or have to do, and just build it into your routine. A healthy diet we list because you have to have certain ingredients in your body for the brain chemistries, the feel-good ones, and there's a bunch of them, to be produced. And that stress management piece is so essential to impulse control. And there are a bunch of techniques that we know work, like deep breathing exercises, yoga, meditation, mindfulness, prayer that is focused on others. But everybody has to find their own self-care. For me, my big self-care is I love to go hiking. So being out in the woods, taking a long walk, I love when I can go out west and go up and down mountains, but around here, I find forest preserves. That's my self-care. Vicki, do you have a self-care that you like to do?
It used to be journaling, but now actually literally it's just sitting still, burning candles, and just deep breathing.
Yeah, well, actually, the deep breathing, the sitting still, that living in that moment, and journaling, those are both research tested as really important self-care techniques.
Yeah.
One of the things journaling does is it brings clarity to what you're actually thinking. Because I know when I'm stewing about something, there's 20 different ways that I could consider it, and some of them make no sense at all. But if I have to write it out, it's part of actually why I started writing books, is I wanted clarity around what I actually thought. It helped me figure out what did I really believe versus what was just a passing thought that went through my brain that really didn't make a whole lot of sense. So having support for loss survivors is really critical. When people suffer a loss, it's just that pain is deep. So AFSP does have some programs. We have a healthy conversation program, healing conversation program for people who've suffered a loss, to connect to somebody else who has that experience and can just help them figure out where to get started. And then there are other groups that do more ongoing support. The Catholic Charities in Chicago has a non-denominational program called Loving Outreach to Survivors of Suicide that does host groups for that kind of peer support that can be really critical. The most important thing we can do when somebody's struggling is to give them time to get past that crisis moment, give them time to think of an alternative to escape their pain other than the one that they are fixated on in that moment. And a key piece of doing that is limiting access to means. So keeping firearms locked up, prescription and other medications, getting those locked away if somebody's struggling, and doing anything else to just make it so that it would take a few minutes for somebody to go from thinking about suicide to taking action on it. It's something that gives them time to think of something else. And these are just a few examples that we're working on, finding some other approaches to make it to buy that time for people. So Vicki, if you want to talk about what people can do to help.
To help those struggling?
Yeah, so if you want.
Yeah, I was going to say, have a conversation, definitely. I have friends who are struggling, and if I see it, I'll just reach out and say, hey, I haven't talked to you in a few days, or how's things going at work? How are things with the kids? What's going on? And then just kind of open up dialogue for them to feel comfortable. Say, you know what, I haven't been myself. I think I need to get back in therapy, or I need to start therapy. So having that conversation is very critical and crucial to someone who may be struggling or having suicidal ideation. And a lot of times some people aren't comfortable enough telling you, but some people are. So just starting it off, letting them know that somebody is here to listen and to help them along the way if they need to have a resource. Yeah, so watching for the warning signs, again, distancing, was one thing. And I don't want to be too candid. My sister always felt that once my one brother moved on his own, that he would execute his wish. And so once he was isolated, we were always kind of on pins and needles. So we reached out even more, oh, we're cooking today. Why don't you come by? And if he didn't, then it would raise a flag or just let him know, hey, we're going to play Monopoly, coming out the house. So things like that, we wanted to just make sure that we kept both of them engaged and let them know that family was here. And again, reaching out and then seeking help. I have resources at work. If you want me to have someone, reach out to you, someone to talk to you, just letting them know that I'm here to be a vessel to a resource for them. And that's what, we should definitely do for those that are seeking help, for their struggle. Again, warning signs, talking about it, in the end of their lives, no reason to live. I hate myself. I'm a burden on you guys. I'm just, trouble. I can't get out of what I'm doing. This pain won't end. Again, unfortunately, each one of these, all 5 related to the, one brother, Paul. Reggie, again, his was Sutton. There was no dialogue leading up to it, but for Paul, unfortunately, these were things, and constantly reassuring him, oh, we love you. You're doing great. You're doing wonderful things. You're making a difference. But these were what I'm trying to say. These were red flags for us. These are the things that were red flags for us. So definitely look for those. Behavior, using more drugs, smoking more marijuana. I can't sleep. Reckless, spending more money, spending their bill money. And can you, give me money? I spent my rent money. I'm just giving examples. Or, oh, I don't want to, I'm done playing football. I quit, but, you're the quarterback. And definitely the isolation from family and friends. That's a huge, huge flag, especially in families such as ours, where we're very close knit. So once you start isolating yourself, that's definitely a huge flag. And then looking for ways. I mean, we never really discussed that. And I'm not going to go into detail that, but that's, if you hear that, then that's something you should definitely be alarmed about and want to get those things removed. And then giving away things, as I told Mike, some people call it Christmas in July, where people start giving away, here, you can have, my puppy, or, you want my car, I was going to sell it, but I'm going to give it to you. Or, oh, I just, I didn't get you anything, so I bought you a gift. Those are telltale signs as well to look for. And then, mood swings, depression, apathy, rage, definitely. I've seen where one of my brothers actually was inflict harm on himself. Irritability, definite impulse, just making irrational decisions, and then feeling humiliated by behavior, and definitely anxiety, which led to not sleeping and, not eating, weight loss, and then other factors. These are all things to look for, to seek support for that individual at this point. And then trust your gut. Yeah. So I want to tell this part, Michael, of the story, and I don't want to focus on Paul as if Paul's death was more devastating than Reggie. They both were. And I think his death was more of a devastation because it came 2 years after the first devastation. But Paul's story was, we would always have a get together with the family to celebrate Reggie's life, around the time that he passed. And when Paul didn't show up or call, and we kept trying and trying, inside, I kind of knew that this was, towards the end of where he was spiraling down. So please reach out to your loved ones, even if you feel that you're getting on their nerves or you're being a burden. You're not. Just keep that constant contact, letting them know you're here. We're all here. I'm gonna stop by. I'm gonna come by your house, and that'll, people go, okay, I'm okay. But still, wellness checks for mental health is very, very, very necessary. So whichever method, you decide to reach out, if it's a phone call, stopping by, a text, an email, please do so, and trust your gut. with, talking to them and saying, I see something's going on, would you consider, talking to someone about your issue? And then how to reach out again in private, listen to them, and make sure you let them know that you're concerned. This isn't coming from a place of judging. This is coming from love, because I love you and I care about you and I want to make sure that you're healthy mentally and physically. Ask them directly, are you thinking of ending your life? And a lot of times, he was very candid about it, and then encourage them to seek mental health services.
Yeah, that part of asking directly is so crucial because,
Mhm.
certainly when I was being raised, you were told don't ask somebody about suicide because you'll put the idea in their head. There's
Right.
been a lot of research studies that have proven that not only does it not do that, it actually reduces the risk of a suicide loss because it lets them know somebody sees that they're struggling. It
Mhm.
gives them some hope that they might be able to get some help.
Mhm.
So asking directly makes a difference. It's really difficult to ask somebody you love this question because you're afraid of the answer. But just stay calm and just listen to them and give them the chance to talk. We all need people to notice and care for us. And when you ask that, it's very clear you care deeply about them, and that makes a difference. We definitely don't. There are a couple things we don't want to do. We don't want to minimize their feeling. We don't want to suggest that you have no reason to feel this way. Everything's going so great for you. It was only a couple of months ago that Miss USA 2019, you know, beautiful young woman, talented lawyer. Everybody thought she had everything going for her. She had some social media posts that would have led you to believe that she was struggling. Well, she was. But people looked at the outside and thought, well, it's not possible that she's struggling. Her life is so great. That's not really how mental health works. So you don't want to try to convince them life is worth living. But you do want to tell them these are all the great things about you because people who are suffering have a hard time seeing they're good. We get so fixated on what's wrong that we miss all the parts of us that are good. And it's not your role to fix, but it is really important to listen and provide them somebody that they can talk to about what they're feeling. And then get experts involved in, try and encourage them to seek mental health support. So somebody who has some expertise can help them. If you think they might make an attempt soon, stay with them. Help them, secure or remove those lethal means. If they have anything in the house where they could end their lives quickly, try and get it out of there. And then you might even want to just escort them to the hospital, or, if it's other places where you can access mental health services, community mental health centers, or other locations where they can get support. Just having somebody sitting with you when you're struggling, even without talking, but just sitting with you, can be really powerful. There are people who are really reluctant to say anything to somebody they know. I helped facilitate some research groups for suicide attempt survivors on the south side of Chicago a few years ago. And I remember several of the people who were in there said they never said a thing about their suicide attempt to their family, but they would talk about it on the bus or the L all the time because they'd wear some mental health related shirt and it would spark up a discussion. I actually do that when I go hiking. I'll wear mental health shirts frequently, and it's amazing how many deep discussions I have with people who are just glad to be able to talk about it with somebody they're comfortable with and that they might not even necessarily need to see. But the Suicide Prevention Lifeline provides that kind of stranger communication where you don't have to see the person. Right now, it's 800-273-8255. On July 1st, it will be a 3-digit number, 988, nationally, which is way easier to remember. For young adults who might be reluctant to talk on the phone, the crisis text line is a valuable resource. So just text talk or help or any other word really to 741-741, and they'll start a conversation. If you've encouraged somebody to call the lifeline or to get on the crisis text line, it's really good to stay with them until that discussion starts. The lifeline has been swamped in the last couple of years since COVID. And so there are times when people will be on hold for a while. And if you happen to be in crisis and you get put on hold, that can be really frustrating. I'll just leave it at that. Of course, for emergencies, call 911. And there's a caveat here that I say in every group that we talk about. If you're calling 911 can seem a threat to some people, and particularly in the African American community, because you don't know that the police response is going to be a help response or is it going to be a punish response. So, if you're calling for somebody who is African American, I would suggest that you make very clear that you want a crisis intervention trained officer to respond, that this is a mental health crisis, and stay right next to the person that you're calling for. Let them know that you're going to keep them safe. Let them know that you want to make sure that whoever responds appropriately. So just keep that in mind, that calling 911 can mean different things in different communities. And it's important to make sure that especially if you're telling a young African-American man, I'm going to call 911, that he may take that as a threat. You've got to make sure that, you let him know how you're going to help make sure he stays safe while you get the help for him that he needs. Together, we want to create a culture that's smart about mental health and suicide prevention. Really appreciate the Village Free Press for hosting this forum. It's always a pleasure to work with Vicki. Vicki has hosted a couple of great forum that I've had the opportunity to speak at and take part in. Always love working with Vicki. She's such just a tremendous person and makes such a difference in helping others. The simple kind of close is that talk saves lives. Talking about this, listening to people, asking questions, it does save lives. So we appreciate everybody who's listening in. And if there are any questions, we would love to take them. And
Well, first, I would like to mention to anyone that's watching, we have the suicide prevention phone number and the crisis text line scrolling at the bottom. And so here I have posted on the screen the suicide prevention lifeline phone number. And then here is the crisis text line. Text talk to 741-741. Mike, could you say once more that you said starting July 1st, you can call 988?
Yes,
Mhm.
yes, that was actually one of the few things that was done on a bipartisan basis, and President Trump signed, that got through during that time period. People recognized that we needed to make it easier for people to get support.
Mhm, mhm. And so we have one comment here, very helpful guidance. I want to go ahead. I'm sorry.
Oh, I was just going to say thank you. And I believe I recognize the individual I think I've seen her speak in some other groups that I've been part of. So thank you for being here.
Mhm. And I just wanted to say thank you so much for the American Foundation for Suicide Prevention, the Illinois chapter, reaching out to us to definitely bring this information to the proviso community. And if you are watching this, please share this with your friends on Facebook, to make sure that if someone ever needed the information, it is here to help, and also to help their loved ones, to help them best. So thank you again. And
Neil, can I just
sure.
before we end, I would like to raise one other issue that I think is really important to your audience, is
Mhm.
changes that we've seen in suicide loss trends among young African American and Hispanic populations. So in the last couple of years, we've seen an increased loss rate among 6 to 11-year-old African American boys in 12 to 17-year-old African American and Hispanic girls. It's really increased at a rate that we're worried about for sure. And I think it's important that we just emphasize that it's really important to, provide those community supports, to check in with young adults, to make sure that they have a supportive community around them, and to make sure they have all the other protective factors, time to exercise, time to socialize one-on-one or in small groups with friends, time to get outdoors if they can do that safely, and just do things where they're able to build their problem-solving skills and resilience. Even things as simple as, having them place orders, just doing things that they haven't done before, just to build their confidence. Little bits like that make a difference and add up over time. So I did want to raise that because it is, we do have a youth mental health crisis that the Surgeon General has outlined, but we are really worried about our minority communities and, and the rates at which we're seeing some increases, especially at younger ages.
Well, thank you for that. And thank you, Mike and Vicky, again for sharing this information, and have a good evening.
Thank
Thank
you,
you.
Camille.